Good morning, everyone. Welcome back. Thank you for joining us. We're glad that you're very glad. I'm Steve.
And I'm Scott.
And together we're Backyard Musings of the Science and Technology channel.
Yeah, and today we're talking about an article similar to the one I think we talked about yesterday that had to do with low birth rates. This has to do with mortality rates. So, yeah, interesting.
All right, a new study examining paternal mortality data in Georgia found that 60% of the deaths were preventable. It took nearly a century for maternal mortality in the United States to be acknowledged, pushed out of focus, and then recognized again as a major public health emergency. Paternal mortality has followed a very different path. Research shows that fathers, especially men from their 20s into their 40s, are more likely to die from preventable causes, including suicide, overdose, homicide, and accidental injury. Even so, deaths among fathers are rarely studied in relation to becoming a parent. Northwestern University scientists are working to bring attention to that gap. Would you like to know more?
So, y'all remember Rush Limbaugh, right?
Yeah.
The great Rush Limbaugh. So he would make a statement like you did there where it says paternal mortality, and he would say, for those in Rio Linda, that means men. So I love that guy. Okay, a new Northwestern study looked at all 130,267 babies born in Georgia in 2017 and followed whether their fathers died at any time over the next 5 years through 2022.
Sad.
Among fathers who died within 5 years, 796. That's a lot.
It's a lot.
I mean,
I'm going to
assume that they're probably young, right?
Yeah, well, within 5 years. So
yeah,
gotta be young.
Yeah, 60% of the deaths were considered preventable. A finding the study authors describe as a huge missed opportunity. The deaths included homicide, 143, accidental injury, 142, suicide, 102, overdose, 93, while 296 fathers died from natural causes. That's just staggering when you look at it that way. I wonder what other states are, if they're similar. The study was recently published in JAMA, which is the Journal of American
Medical Association.
American Medical Association.
Pediatrics.
Specifying on pediatrics on May 4th of this year, so just a couple weeks ago.
So all of those, of the 5 little categories there, the natural causes seem, understandable. The others, gosh, those are preventable,
Yeah.
Man.
Yeah, absolutely. And again, natural causes, that just seems like,
heart attack.
That's a third of the number, right? More than a third.
Yeah, so my brother, he had a 5-year-old and 2-year-old, and he passed away, arrhythmia, irregular heartbeat, and he died. So he falls into that natural cause within 5 years of 2 births.
Yeah, that's sad.
Yeah.
Okay.
Yeah, so maternal mortality review committees examine deaths of mothers during the first year of a child's life in focused detail. By contrast, this is, to the researchers' knowledge, the first study in a major medical journal to examine fathers' deaths in the years after a child is born. Quote, our data show that fathers die frequently in the first years of their child's life, and we have no systems in place to understand how we might prevent it, said corresponding author Dr. Greg Garfield, professor of pediatrics and medical social sciences at Northwestern University Feinberg School of Medicine. That's a huge blind spot, he says.
I agree with that. The findings mirror a central lesson from maternal mortality research. Deaths around the shift into parenthood are often driven by social vulnerability than biology, and many can be prevented. Yet paternal deaths are still largely not tracked or addressed. Previous research has found that father involvement is associated with better health outcomes for children and families, while father absence is linked to a range of negative outcomes for children. Yeah, and again, I'm not pointing fingers or picking on anything, but the late, great Charlie Kirk used to bring up all the time when people would talk about crime issues in the Black community. And
Yeah.
he would say, well, 70% of Black homes don't have a father. And maybe they're part of this study, or not. I mean, not this particular study, but they could study that to find out, are they incarcerated? Did they die? Did they commit suicide? I mean, maybe they're not just AWOL, but one way or the other, they're AWOL, right? They're away. So sad deal. And we know that 80% of the crime that's committed in the country is committed by Blacks, and they're only like 13-14% of the population. So the numbers don't lie. It's unfortunate. So anyway.
Hey, this is a strange one here. Although fathers in the study died more often from preventable causes than from some other causes, the scientists found that being a father was linked with lower death rates among all men in Georgia between 2017 and 2022.
Yeah, that's a aha moment, right? That's good.
Well, it kind of tells me that the fathers, new fathers, are not taking risks that men who are not fathers or not newborn fathers are taking. That's kind of what it sort of.
Yeah. Okay. After age 20, fathers consistently had lower death rates than men who were not fathers. Among men ages 30 to 34, for example, Georgia fathers had a death rate of 120 deaths per 100,000 men, compared with 231 deaths per 100,000 men among Georgia men who are not fathers. Being a father appears to be protective in this particular group of men. That's a quote from Garfield. We were surprised, going on with the quote, we were surprised to see reduced mortality among men who are fathers. Whether that is due to changes in lifestyle or new purpose or new roles and responsibility, we don't know. But it is certainly worth further study. Yeah.
So give me your money is what they say.
We need more money to study this. Right.
The scientists reviewed all births in Georgia from 2017 to 2022 and connected those records with death records for fathers named on birth certificates. They examined causes of death, overall mortality rates, and whether fatherhood itself appeared to change men's risk of dying.
Non-natural deaths were more common among younger fathers. Births paid for by Medicaid and unmarried status were associated with higher homicide risk. Fathers who died were more likely to have been older, non-Hispanic Black, whatever that is, I don't know, unmarried, living in rural areas, and connected to Medicaid paid births. Higher education, Hispanic ethnicity, and TRICARE paid births were linked with fewer deaths. I wonder what TRICARE is.
TRICARE is military.
Oh, is that their military?
Yeah, okay. For armed forces.
Got it.
Active duty. Okay, Garfield, a pediatrician at Ann and Robert H. Lurie Children's Hospital, Chicago, that's the Lurie Hospital, not the Lurie Center, said his clinical experience helped motivate the study. He has seen many cases in which mothers in the neonatal intensive care unit were grieving the death of a partner from causes such as a shooting, car crash, or another sudden event.
Another quote here. In my experience, that happens more often than mothers dying, according to Garfield. The death of any parent has enormous consequences for a child, and as a pediatrician, I care most about how a parent's death impacts the child, especially in the early years.
Yeah, so my brother's 5-year-old, he took it really hard. He knew what was going on, and he took it really hard. And it affected him, growing up. And then the 2-year-old didn't affect him. I mean, initially, the tears couldn't stop because his daddy would play with him. He loved his dad, my brother, so much. But then afterwards, he's so resilient. He overcame it, and he, fared better than his older brother.
How are they doing today?
Well, the younger one is thriving. He's got a business. Strange enough, it's a thriving business that he created. And
Nice.
then the older one is doing good.
Good.
Got a family. Yep.
Nice.
Yeah.
So they're adults now.
Yeah, they're adults now. Yeah. Jimmy is how old is Jimmy? 35, maybe 40.
Did your sister-in-law remarry?
Eventually. She took it really hard. Eventually, she remarried, and I still include her as a sister, in our communications, text messages and stuff. She's included, and she
Nice.
sometimes comes to events.
Cool.
Family
Now,
events.
does she live close to where you're going to be living in Michigan? No.
No, she's in. I think she's in Pennsylvania.
Oh, okay.
I think so. Yeah.
So, yeah, bit of a drive.
Yeah. All right. Garfield has published dozens of papers on fathers' mental and physical health, but he said he found little existing research on deaths among fathers in the years immediately after a child was born.
A national analysis of paternal mortality is not currently possible. Birth and death data are gathered by states, but when the information is compiled nationally, personally identifiable details are removed. I don't wonder what that is. That makes it impossible to determine individual cause of death and many other key factors. Garfield and team were able to use Georgia's data through an existing project, the Pregnancy Risk Assessment Monitoring Systems for Dads, or PRAMS for Dads, survey, which they created and first piloted in Georgia in 2018.
He hopes the results will encourage other states to examine their own data, build a clear state-by-state picture of paternal mortality, and eventually work together on a system for understanding this national issue. Quote, "If we don't measure it, we can't change it," Garfield said. "That affects thousands of children." True story.
Yeah, true story. Yeah, and those numbers, man, those numbers that we were talking about earlier, those are sizable numbers. So
Yeah.
definitely should be raising some eyebrows. So
Yeah.
anyway, okay.
Well, we brought attention to it. Hopefully our viewers can spread the word too,
Absolutely. Yep.
All right.
Okay.
Thanks for joining us.
See you this afternoon. Thanks.